Good evening, friends. Sunday evening. A nice this thing to know that a couple of vaccines have been approved by the Drug Control Board in India. The Oxford vaccine first, and then the Bharat Biotech. Yeah, I think because what I personally feel is that there has been a lot of talk even amongst people of intelligence saying that don't take the vaccine has this thing, that thing. See, of course, vaccines to be studied and then let out takes years, 7 to 10 years. But then these companies have been working round the clock 24 hours, doing all sorts of research, and all the trials required have been fast tracked and done. And then they've got an effective vaccines for that matter. Probably Pfizer's vaccine, mRNA vaccine, very difficult to use in our country because it has to be stored under minus 72 degrees. So accessibility as well as the price. But when you look at the Oxford vaccine and the other vaccine now, when we see price is affordable, it can be stored between in the freezer temperature of 2 to 8 degrees, and then the efficacy is also very good. When you look at a vaccine, you look at the efficiency of the vaccine and the side effects. And this is made, it is not live cells, you got to remember. From chimp clumps, a protein is made. This protein gets activated, and starts giving an immune response in the body when the coronavirus enters. So this effectively neutralizes. And there have been a little bit of controversy regarding the dosage of Oxford vaccine. They had found in a small trial that half the dose in the first injection shot plus the full dose in the second gives a much better protection. But this is not clear because this was done in a very small group of people, and those less than 55 years. But overall, when you see, we see the efficacy is nearing 90%. And the standards for any vaccine approval would be over 50%, it is recommended. When you look at swine flu vaccine, 56%, we are taking it. Probably the others, they develop herd immunity. You'll have to remember this also. Why I am telling you this is that there have been reports of some people developing all complications and all that, but there has not been a single death, and the supposedly said neurological complications were reversible, supposedly mild transverse myelitis. But the commonest reactions are those reactions which are there in any vaccine. When you go for probably even your regular, pneumococcal vaccine in elderly, vaccination in the elderly, I want to speak about it some other time. They're like children, they need to be vaccinated on a whole. Overall in India, it will come to around 8,000 rupees, protecting them against various disorders. Now we are talking about COVID here. So there should not be any doubt in anyone's mind regarding taking the vaccine. Then you should have a doubt, I'll not cross the road, even carefully, I might get hit and die, remain at home. That sort of thing. It becomes irritating as a doctor when you look at it, politics coming into play. What do politicians know about vaccines? What do politicians really know about vaccines to talk about that, telling that I will not take this, I will not take that? You better shut your mouth. That's what I am apolitical, I'll tell you. But then something good is happening in the country, trying to do something after a year of suffering and this thing. Don't stop it. Don't poke your nose into it. You've got no right. You can keep you're entitled to your opinion, keep it to yourself. Don't keep it to yourself. But then you should also realize that those developing COVID now, mild, getting on, I'm not frightening. There have been a lot of post-COVID complications, including a lot of neurological disorders, especially in elderly people, and other organ damage. So those telling that nothing will happen to me, when it comes, then you know, then you realize experience will be the best teacher. We are hoping that doesn't happen. So it doesn't mean that so far if I have not got it, I won't get it, no one will get it, no vaccination, those things. Stupid talk. Stop. I think the government should stop this WhatsApp messaging by people who don't know about it. Because these are all peer reviewed by top people in the world, working inside out and seeing the reactions and the efficacy and the cost and everything, and then the drug control in India, they have waited for 2 weeks, then they have given the approval. Are they mad people? Spending billions of this thing on the public, for the public? You should understand that. If you've got doubts, talk to your doctor who's a family doctor. Let him explain. See, if I have got a doubt in law, legal this thing, I go to a lawyer, I don't go to a barber. It is like this. Somebody, some politician, some nonsense talking about something about which he doesn't know anything about, and people who is following him, they are also clamoring about it. Make use of it. Please do make use of it. There are, of course, some side effects. With every vaccine it is there. That is why we keep adrenaline and probably steroids, everything there when you're vaccinating, even ordinary vaccine for children. Because you can develop anaphylaxis, you can develop pain at the site of this thing, you can develop fever for some time. It's all known. But these are temporary, minimal, trivial things. And when that happens with the new vaccine, I have got pain, I develop fever. There was a guy somewhere, Ramachandra, given a placebo. He said that I had developed a weakness, and he was given a placebo. And he had the audacity to go and file a claim for 10 crores or something. What is this happening? What are you trying to do? You're trying to destroy lives of others when the government and other people are trying to do something for you. Make your own decisions. And by the way, India is probably the largest manufacturer of all the vaccines put together. About 60% of all vaccines, including polio, this, that, and all that's made in India, not in China, not anywhere else. And then Zydus Cadila. See, I am apolitical, but I have been following this thing. This Prime Minister on a single day visited 3 of the centers where vaccines were made, Ahmedabad, Hyderabad, wherever, in one day, fully went through the processes which were being followed, inquired about this, came back on the same day. I'm not telling, I'm not a politician to tell vote for him. I'm not telling, but he did that. He could have done it over video. He could have talked over video. So when somebody is doing something good, we'll have to accept it with gratitude. See, you cannot say all this coronavirus is devious. Sometime later, probably it will mutate. Where it mutates? In people who are vulnerable. When you are vaccinated, you found that the immunogenicity increases. And what they say with the Oxford vaccine is that the first dose and the second dose is on the 28th day. And there is another school of thought, probably 12 weeks later, because you develop sufficient antibodies, and the 12-week period gives chance for the lot of others to get vaccinated. So people are breaking their heads how to get the mass vaccination done rather than confine it to certain those things. So when so much of thought goes into it, so much of those things, and I'd say that the Bharat Biotech, those thing and all, it has been developed totally by the ICMR people. First vaccine in India, in our indigenous one. So we should be proud. And those all the top heads, scientists, top brilliant people of ICMR, doctors, scientists, all reviewing this and okaying it. And the world body. And the vaccine by Zydus Cadila, I heard, I think it has all been tested in India. But it doesn't matter because the virus is worldwide, and they have done, this Oxford vaccine was widely tested all over UK, if I remember, Brazil and South America. There have been no casualties apart from few minimal side effects, no deaths. And what complications occurred, patients had some problems before. So before you get vaccinated, talk about any neurological problems which you had. If you look at the rabies vaccine first, see, you might get better vaccines, this thing later on, but what you're talking about is the present a vaccine which is potent, vaccine which can give you immunity, vaccine which has got minimal side effects, very, very rare, body pain, fever, this, that. You can get it when you get flu also. Imagine if you get COVID and then go and with a kidney failure and other things and die. You'll have to broaden your thinking and see, not confine it. Tunnel vision is not worth it. So, you'll have to make a choice. So, anti-vacciners can become carriers, they can develop problems later on, probably they should not regret later on, I pray to God. They should not be transmitting it to others and creating problems. Even if 70% of the population is vaccinated, herd immunity might develop, most probably. But then, once again, the only thing we don't know is how long the effectiveness will be. But then if the effectiveness is for a short period, probably 7-8 months, who knows, if all are those things, the disease might vanish. But the problem with COVID is that we don't know. Usually with viruses, the mutations, it becomes less virile, less powerful. But here, sometimes it has one strain has shown being more powerful, causing damages. So what is there at that moment we have to take? And the better vaccines when it comes next time. When you look at the rabies vaccine, first was a neurological vaccine. A lot of neurological problems were there. Now we have got human diploid cell vaccines. After several years of research, which has no side effects at all. Give science time. Just show your gratitude to these people who have been working day in and day out and doing everything and then clearing it and then getting it peer reviewed, clearing it, and the government getting approval and the drug bodies of the countries clearing it and then saying it is okay. And then if some politician says, I will not take because it is not my political party which has created it, it is rubbish. I don't know what more to say about this. Nothing against anyone, but this is because it affects the whole population. I'm talking as a doctor. I've got a right. I'm an Indian citizen. So please do go ahead. Clear your doubts with your doctor when you're getting vaccinated, not with anyone else, not with a politician, not with a barber, nor anyone else, but with a doctor of knowledge about this. And then please go ahead, protect yourself, protect your family, protect the society, protect the world. That's what I'd like to say. Have a wonderful week. Tomorrow is Monday. Work starts again. Have a nice night.